a group of young people. They call themselves No Yawa. It sounds, like a yo-yo sort of thing, but they're doing something really, really important. It caught my attention, and I thought that we should have them here so that they can talk more about it. Most importantly, I want you parents out there to know what your young people are talking about. We'll see how best we can help them. So joining me, Philomena Hammond and Leonard Goba is Manager Youth Project at Mary Stopes International. Good morning to you guys.
Good morning.
So No Yawa, Philomena, you are very young. Yeah. I want to hear you tell us about No Yawa.
Yeah, so No Yawa is basically a platform created for Ghanaian youth to enable them talk about issues concerning them about reproductive health. So we realize that in Ghana, because of our customs, our traditions, our morals, some things are not permitted to be said publicly or generally. So we realize that our youth really want to talk to their parents, but it's not always easy because they think what I'm about to say is wrong, and then they fall on their peers, get misconceptions, and do a whole lot of things that put them at risk. So we have realized that there is the need for such a platform that talking about your reproductive health is not going to be like a taboo, but rather, you are being responsible to think about what to do. And so basically this is all No Yawa is all about, a platform for the youth so that they can talk about issues concerning them.
Okay.
And also get
I'll come back to how you got involved. I mean, if you've had issues yourself that you needed some sort of help. But Leonard, what are young people talking about? And if we say young people, what age brackets are we looking at?
Thank you very much, Mama V. When we talk about young people by the global definition, we are talking about people in the age range of 15 to 24, both male, female, in school and out of school.
Okay.
And that is what the project is for, to address their needs, as Philomena said. Not just giving out information, but accurate information. And after the information, what next? They must receive services. And that is what No Yawa is about. Information and service delivery for young people in the area of sexual and reproductive health.
Okay. So these platforms you've created, there's a Facebook account.
Sure.
You also have phone lines that they call.
Right.
So typically, how many people would we have calling or asking you questions in a day?
Yeah, we have created a number of platforms, as you've said. We have the Facebook page, and this project is just about a year old. And we are actually hitting 10,000 young people on the Facebook platform, talking about issues concerning sex, their boyfriend and girlfriends, relationships. Should I say yes to sex? Should I say no? What are the various contraceptive methods that young people can use? They talk about abortion. They talk about masturbation. Those issues that hitherto young people were afraid to talk about. And we also have a platform which we call the call center at our Mary Stopes office. We call the Mary Call, where young people and generally everybody calls in to seek information about sexual and reproductive health, to seek direction to where they can receive service. And I tell you, it is growing phenomenally. People are calling in, and we even get surprised at the response of young people.
How young are people? I mean, I want to understand. What's the youngest person who's called, for instance?
The last record I saw yesterday, we had people as young as 12 years calling.
On what issues specifically?
Some of them talk about discharges they are having in their private parts. Some of them talk about wet dreams. When things like that happen.
Are these not things that you should be talking to your parents? I mean, are they not the people closest to you that you can be talking to them about?
That is where the challenge is. As Philomena said, we've been indoctrinated or acculturated to think that issues around sex should not be talked about between parents and their children. That is why we are having the challenge.
Worrying.
It is worrying because we are not open. We call every part of the body. We talk about the head, the ears, the nose, then we jump to the legs.
We just say
and we leave
parts.
Exactly. We think that parents should start talking about these issues with children as young as 4 years.
Oh, as young as 4 years. What would they understand?
Just teaching them the name
like, what's mommy talking about?
The name of the parts. This is your this. This is your penis. This is your vagina, and not kakai. So that when they grow old, it grows. I mean, they grow up with it, and they are confident to approach their parents. That is where the empowerment starts. So that we don't have the challenges we are having as they grow into adolescence and their youthful ages.
Philomena, did you have challenges before joining No Yawa?
Yes, I had a lot of challenges. It's like I was brought up from the kind of background, this kind of Christian background, and so at
which
home,
is a good thing.
Yeah, which is very good. But it was like, because of some of the things we were learning, if you want to talk about sex and its related issues, you are afraid yourself, because you know, as a young person, you don't have to talk too much about these things. But I realized that as I was growing, I had rare needs, and I really wanted to talk to mom. And to her, she thinks she had created that platform that I could talk to her. But because of the morals and all the things we've been learning, to me, it wasn't so easy to talk to mom. So it all started that a friend had to introduce me to a program, a youth program, and from there I got to know the No Yawa program. Really? Yeah, and it's been really helpful.
And it's interesting, if you say your mom thought that she had created that platform, I'm thinking, what exactly did you want to see before opening up?
Yeah, it's like we youth have our own ways of knowing what mommy would think. So it starts with a question, just as Uncle Leo was saying, just that when you ask mommy, what is this, what is it called, and then they have to tell you, you get to know when you are old. And if it's the penis or the vagina, they tell you it's kakai. So just there you get the perception that mommy don't really want you to know something about that yet. Yet maybe you are starting to experience some things around those parts, and then you then conclude that mommy would not really like me to ask a question again about this, and she's not really going to tell me something. And then you fall on friends. When you go to school, you then start to ask among yourselves, and the truth is, it's not all the time that you get the right information. Normally, they are also going through similar changes. They are confused as yourself, and so they tend to give you misconceptions, things they've heard. And it doesn't really help.
It's true. How do you know if we have a lot of these channels, these platforms available? Because it comforts me to know that there's a platform like this. But on the other side, I am worried because not everybody can have access to No Yawa, for instance. You know, which means there are people out there who really want to talk to their parent, but who cannot.
Yes, I've mentioned these channels. Yes, the youth have become very savvy technologically, so we are also using those channels. But apart from that, we also know that there are some young people in the hinterland who don't have access to the Facebooks, the Twitters, the Vibers, and so on. So we have outreach programs. So people like Philomena and other young people that we have trained as ambassadors go into the community to talk to their peers. We have evening film shows where we show documentaries about sexual and reproductive health, their rights, what they need to know, and all that. Then apart from that, we also realize that when young people are empowered now, they have to go to a health facility to seek service. When they go, how will they be received? Will the health professional turn the young person away because this young person has issues with his sex organ?
Or perhaps they may be pregnant.
They may be pregnant.
You know, and some senior nurses will say, in pain, you say, well,
exactly.
you know, that kind of thing.
Exactly. In my language, they will say, who taught you this? So we are saying that going further, we are training the health service providers across Ghana to be youth-friendly, not to be judgmental. When young people have the confidence and they walk into their health centers, they should receive them, counsel them, and give them appropriate services because it is their right.
But Leonard, if a 15-year-old, calls or gets in touch and the person says that I want to have sex, I mean, are you going to tell this young 15-year-old that no, don't have sex, or what exactly are you going to tell the person?
Not at all. We are not going to tell the 15-year-old not to have sex. Because
why not? Because at 15, as a parent, I still feel that you're young.
Yes, but I think we scientists talk about evidence. But the evidence on the ground is that a lot of young people are already experimenting with sex. The sexual debut age is so low, and the marriage age is high. So look at that gap. The marriage,
so what are you advocating?
what we are advocating is that if you want to have protection so that you don't have STIs, you don't have unwanted pregnancies.
So you're telling the 15-year-old these other options that you have if you want to have sex?
No, Yawa is about options and not about judgment.
But really, is that safe for our society?
You see, we have this cliche that we've been using, that we've buried our heads in the sand for far too long. As I'm saying, the evidence is that it is happening.
Okay, so let me ask a very personal question.
Yes.
Would you let your 15-year-old have sex? I mean, would you let your 15-year-old have a boyfriend or a girlfriend, and then, you know, knowing very well that they're having sex, would you be comfortable?
No, from my background, I will start educating my 15-year-old son or daughter to know about the implications of having sex. So I believe that with my constant education, with my constant counseling, my 15-year-old would not have sex. But in my education, being a public health person, I will also consciously or unconsciously bring out the issues of protection, so that when he or she goes out there and he's faced with this temptation, sort of, he or she will know how to protect himself.
Philomena, how do people receive you? I mean, do you have issues with parents, for instance? Because if a parent gets to know that you're talking to, you know, their 12-year-old about options, you know, how to protect yourself, how to have safe sex, it's a big deal.
Yeah, it's a big challenge out there, but I would say the response out there so far is so great. And even parents are calling and giving us their children's number. This is my child, and I want her or him to be a part of the program. In as much as we are getting people who are not agreeing with the concept, gradually, and as the education is going on, they are getting to understand the concept and they are embracing it. To my amazement, because it's all about what is the reality on the ground. What are the children doing? So during the education out there, they get to understand a whole lot of things, not just a portion. So they get to know that the reality is that they are doing it. When we talk about teenage pregnancy, we are not talking about the older ones. And when we are talking about STIs, we don't talk about the older ones. It's all with the youth. So whether we like it or not, they are the main practices of sex. So we are trying to let them be informed so that they can make informed choices. And during the process of our education, we emphasize on abstinence being the main and the first choice that can help them in everything they want to do. At the end of the day, what we aim at is that they all grow up to realize their fullest potentials. So anything that is going to be a hindrance on your way so that you wouldn't get to the top, that is what we want to avoid. So if we let you know the various choices and what they can give you, then I'm sure they'll make the right choices. And in case they are confronted with some kind of temptation,
do young people also talk about abortion?
Exactly, young people talk about abortion. Because look, when we talk of maternal mortality, abortion is about the highest contributor to maternal mortality. And young people talk about abortion. And what do we tell them? You know, Ghana has an abortion law. And there are conditions for accessing an abortion service and a safe abortion service that Maristobes and other organizations provide. We've realized that young people are having very unorthodox ways of having unsafe abortions, like broken bottles, like inserting sticks into their vagina, like taking concoctions, and so many other things. So Maristobes and other NGOs and other providers have provided a safer option to young people. And we are saying that instead of going out there to go and have unsafe abortion that will lead to future consequences, infertility, and even death, why won't you have a safe option provided by very competent people, and your reproductive rights and health?
Would we not be pampering them for doing the wrong thing? Why don't you live with what you decided to practice when you're not supposed to?
You see, when we leave them to go, what are we saying? What are
We're teaching them a lesson.
So they die? Is that the
live
lesson?
with the consequences. We're not wishing you death, but you wanted to be pregnant. That's why you had sex.
Yeah.
So you're pregnant. Live with it. Care for a baby, and let's see if you do it again.
You see, we provide what we call comprehensive abortion care. And in comprehensive abortion care, we provide counseling. And after we give you the safe abortion service, we counsel you and we provide you with what? A contraceptive method, so that we prevent repeated abortions. It's not our pride as an organization to be having people coming for repeated abortions. So in addition to providing safe abortion services, we also add on contraceptives, and especially the long-term contraceptives that will take you 5 years and 10 years, so that young people do not keep coming in for repeated abortions.
So if you're below 18, do you need your parents' permission to carry out an abortion?
You need not necessarily a parent, but a significant adult that we call locus parentis, somebody who can stand in for you to sign your consent for you.
And they agree that they should go ahead and have abortions? How young? I mean, what's the youngest person who has had an abortion?
Oh, it could be as low as 12, 14. Yes.
Wow.
Yes.
How does that make you feel, Philo?
Yeah, it's not really good if we think generally, but the truth is, when we went out there, we had some research, and some of the findings, just as he said, some people even climb on top of story building, fall down in the name of having an abortion.
Oh.
So if it must be done, why not done well? And we have to look at the other sides of it. Not all people who have abortion don't learn lessons from it. Maybe they do it for the first time and they learn from it and make.
But when we make the process so easy for them, you can get rid of it, you know.
Yeah, so with our program, they carry on not just that, but after that we monitor you, see your progress and all that. And normally it's like, we want you to get back to school. And so after that, we see if you are back to school and you are on track now. And normally, some people get pregnant and they give birth.
Okay.
Some people want to talk to their parents to even allow them be at home, give birth and get back to school, and it's not going down well. This is where my research or the whole project comes in, No Yawa. We get down to the grassroots, make your parents understand why they have to take you back. After delivery, we make sure you get back to school, so that at the end of the day, you realize your fullest potentials. Yeah.
And Madam, to add, there was a research carried out in Ghana among young people that shows that young people are more afraid of contraceptives than abortion. Is that not scary? They are more afraid of contraceptives because of the misconceptions that are around contraceptives. Some of them are, if you take contraceptives, you will grow infertile, you will not have children again. Some of you say that contraceptives will move from your private part or the vagina into your heart. And these are some of the misconceptions No Yawa wants to clear out, so that young people feel confident.
But is it not also because as young as they are, they shouldn't know about contraceptives in the first place?
They should. It is their right. According to the UN conventions, every person, including a young person, has the right to information about sexual and reproductive health.
How do parents feel about your existence?
Maybe a young person.
Are you not taking over the job of parents?
No, we are not, because when we go out there, what the parents say is, we are supposed to be doing what you are doing. But the truth is, we don't have the time. We have not even created a platform where the children will feel comfortable around us, talking about some of these things. And so they turn up thanking us for our existence. The truth is that. And sometimes when we go to the communities, the elders, the leaders of the community come to us and they are like very thankful for the whole program, because in as much as their traditions and all that is not allowing them to talk about it, they know it is a need, a real need, and it is taking most of the youth away. Teenage pregnancy is rampant so much in Ghana and some of the regions, and we have realized that they need such a program. They need such a program.
Okay, so you are so involved in this whole project. I want you to tell parents what it is that they can do that will send a positive signal to their children, that, oh, I'm open, no matter the conversation, no matter where you take it from, I won't judge you, but I will listen to you and then we'll have a chat.
Yeah. You see, what we just want to tell parents is that right from, as I said, right from the pre-adolescence age, that is from 5 to 9, let's start engaging our young people, the children so-called. We are not saying go into any technical details.
Okay.
Just start gradually with the parts, with what they do. Some children even ask their parents, Mommy, where did I come from? That is a good opportunity for you to start some sort of education.
So you tell them
yes,
that, you know, this is what I did and I got you into my womb and then I had you.
Yes, you tell them and tell them that, you see, you get to a certain age, then when you marry, you do that, then you give birth. When you don't marry, these are the consequences. You see, that is a positive message we are sending to the children. Then gradually, when they are growing, it will be so easy for you to go into the serious and the technical details of sex, of protection, of STIs, of abortion, contraceptives, and all that. So it's a gradual process, because especially of our cultural myths and misconceptions. It is so difficult when you don't start at an early age and you want to do it when they are already 14, 15. But when you start gradually, you can make it. And that's,
you know, sometimes we say cultural and morals, but you'll be surprised, you know, that people who really even practice the traditions strictly, their children are more comfortable with them, because the so-called modern people are so busy with their work.
Yes.
They're not available for their children.
Yeah.
I'll let Philomena, if there's something more that you want to add to this.
Just what he said. I also think the education should start at a very tender age, and look at the age and then what kind of information to give the child. Because you realize that those youth we meet out there who are already empowered by their parents, they are so firm. And so when they go to school and they hear this kind of misconceptions going on, sex is nice, I have to try it and all that, and they are so bold to say, no, sex is not good, I have learned it. When I do it at this stage, this is the various outcomes that can come, and I am not ready to take care of that, so I will wait. So they are more empowered, more strong when they hear it from their parents. And so that should start at a very tender age. At age 4 or 5, they can start to know of the correct names for the various parts of the body. And so should
it looks like that's very important.
It is very important.
Knowing the parts of the body.
Look, during even our training for health service providers, we even went further to have a session where we group them according to the various languages in Ghana to actually go into detail and give out the local names of the various parts.
Wow.
And you will be surprised that even adults like us do not even know the names in the local languages.
And even when we do, it's very
difficult to even say them out.
Yeah.
Yes.
Wow. And I really hope that you're able to sustain this project.
Yes.
What's the idea?
Yes, it is very sustainable, because Maristopes and the other NGOs that are Fiesta Condom is involved. Kids Condom is involved.
So these are different people coming together.
It's a partnership between Maristopes, DKT International, who are the producers of Fiesta, Kids Condom, and Lydia range of contraceptives.
Okay.
Then we also have a third NGO, Grameen Foundation. They use mobile technology to reach young people. So we text messages regularly, we send voice messages to young people to listen to information. So this is very sustainable. These are organizations that have come to stay. And because we are also running this project through the existing governmental institutions, Ghana Education Service, Ghana Health Service, we believe that this will carry on even after the project has ended.
I tell you what, when I want little gossip on what young people are talking about, I always call you.
You are welcome.
But let people know how they can get in touch with you. I think that will be the final thing.
Right. You know, as we say, our tagline is "No Yawa, we there for you." We are there for the young people, and we have a call center that young people can readily call, and it is 0302 20 85 85. Then we also have a toll-free line for Vodafone users that you can call free. It is 0800 285 85, and we'll be there for you.
Yeah,
Right.
and they
So
can
you
also
also-
join us on the Facebook page No Yawa GH. And when they call, we'll try our best to also register them on the SMS platform, where weekly they will be receiving text messages, free advice and alerts twice in the week, Wednesdays and Saturdays.
Okay.
Yeah.
And they should also watch out for the No Yawa train in their community, because we are in every community. We are taking Ghana by storm.
Yeah.
You're excited about it, and I think that's why I'm also excited
I am
about
so
it. Thank you,
excited.
Leonard and
Thank you
Philomena,
very
for being
much
here.
for the
Stay with us
opportunity.
here on the AM show. Stay with us.